Hey guys, I am going to try to educate people on like medicine and health and stuff on this channel. And my background is in medicine, but I've been out of practice for a while, so I've been kind of reviewing things and relearning things or even learning new things, and I thought it'd be nice to try to teach you guys as well. And today we're gonna begin with hypertension. I'm not done yet with taking notes and looking through like this first up-to-date article. Up-to-date is this basically Wikipedia for doctors, like a medical Wikipedia. There's, I think Dynamed's the other big one that I know of, that's like kind of comprehensive medicine, or good overviews and pretty trusted resource. And so I wanted to start off with high blood pressure. One, because it's so common, but two, because I'm struggling with it myself. And so I thought it'd be easier to learn if there actually is like a case in front of you. And so for my case, I've been struggling with high blood pressure for a little while. It's kind of sucked because it's forced me to acknowledge that I have gained weight, which is part of the problem, but I think another part is chronic stress. And yeah. So yesterday I went to the doctor's office, and the primary care clinic I go to, it's like PAs and NPs, and yesterday I think my regular PA was out sick, and so there was someone kind of subbing in, and so I saw her. And it was the first time she had encountered me with high blood pressure. My previous one already had. We tried some treatment last year, and I'll get into those details later if you guys are interested, but I don't want to go too long on this part. But basically yesterday they took a few blood pressures, and the one that's documented in my discharge, papers was the 139/100. So both are actually considered high. But for me, it's always been the diastolic, which is the bottom number, that has kind of been scary and relevant for me. And today, just a few hours ago, I already took some blood pressures, but I didn't really do it properly, as in like I did have some coffee. It was just a leftover coffee that was like one shot of espresso in there, but I am very caffeine sensitive. So there's that. And then there were issues yesterday with taking the blood pressure in clinic. In my experience as a patient and as a med student and doctor, very rarely do I see blood pressures taken the very proper way, how it's supposed to be taken, what the textbooks say, what guidelines say. And so it makes me wonder if hypertension, aka high blood pressure, consistently elevated blood pressure, is if it's overdiagnosed. But I don't know. I haven't done that amount of research into it. But anyways, I will go over this in a bit, but I just wanted to start off here. This is this cardiology unit I'm looking at, and the first topic in it was high blood pressure, and UTD is up to date, and that big article is called Overview of Hypertension in Adults. If you see HTN, that's just how I shorten hypertension. I think a lot of doctors do that. And the main kind of intro. So hypertension is a major RF, is risk factor. So for heart disease, including heart attacks and stroke. So that's kind of why we try to treat hypertension when we find it and diagnose it properly. I think the proper diagnosis is so key and important. The reason why we worry about it is because it affects your vessels. It's just blood pressure measurements. They tell us how stiff, how relaxed, how well they can kind of stiffen and relax, how well those vessels are working. And that in turn can affect things like your heart, your brain, your kidneys. There's just so many things that it can affect. And that's why it's important, because sometimes I think maybe patients, and even for me before med school, right? What's the big deal with high blood pressure? But when you learn the reasons behind it, it makes sense, because if you can control it, if you can even start to control it and treat it, then there's no, and that'll be a separate conversation of treatment versus cures. But if you can control it, that's going to decrease your risk for heart attacks, strokes, other issues. You can even, if your hypertension has been going on long enough and is bad enough, it can affect your vision too. Like there's so many things, your vessels, they provide blood everywhere, and your cells, they need blood, they need the oxygen, they need the nutrients. And so that's why it's kind of so pervasive. But heart attacks and strokes are like the biggest things that we're worried about, because those can either kill you or leave really lasting, like damaging effects. And yeah, anyways, sorry, I'm probably going to go off on tangents a lot just because that's just how the way I am. And yeah, anyways, so the definition that UpToDate uses is that they use the ACC, the American College of Cardiology, or the AHA, or the like they're two separate organizations, American Heart Association. They use that definition because there are different organizations, different medical entities and stuff. They have different, a little kind of, the definition differs a little bit. But I wrote this down because this is really important, and this is what I have a huge issue with when I see this in practice. Proper measurement technique, blah, blah, is of paramount importance when identifying patients as having hypertension. So the reason it's so important is because, to me, well, one is that you don't want to fix something if it's not even properly diagnosed. If that's not the problem, you don't want to throw things at it. If it was just like some patient came rushing in, just had like some coffee or whatever, and their blood pressure is high, that's different from them having high blood pressure constantly, every day, 24/7, right? That's just like, well, that makes sense why your blood pressure is high. You rushed in, all of that. Like, it's normal for our blood pressures to change and vary throughout the day. That's healthy. And when you're lying down, when you're in the different positions, that all affects your blood pressure. It's not a thing that's like constant and static. And so I said see printout, which is table 1, which I have right here. And I think, let's actually just go into that. How to properly take blood pressure and why I have such an issue. Because yesterday when I went to the doctors and they got this measurement, I think we took 3 measurements. None of that was the proper way. Part of it is my own size, which I can't help, that I'm small and my feet don't reach the ground. But part of it was that I haven't found barely any clinic that does a proper blood pressure reading where the medical assistants or whoever is not talking to you, where they've let you sit for, like, this thing says for 5 minutes. I've learned 5 to 10 minutes. Just resting, feet on the ground, back supported. This one doesn't say back supported. And the arm at the same level of your heart is really, really important. And there's so many other factors too. Like yesterday, I had coffee. They forgot to ask me about that. I remembered it at the end and told them. And I didn't even realize until after they took it, but I was like, oh, I really have to go to use the restroom. Like, I have to go pee. And even that can affect your blood pressure. So let's just go into what UpToDate says, right? Because what I'm telling you is what I remember.